All right, I'd like to welcome you to this webinar talking about pain. It's called Understanding Pain, Addressing Common Misconceptions and Empowering Your Recovery. Let's take a look at what we're going to talk about. So, before we get into what pain is and isn't, we're going to take a look at the pain management industry just to have a good understanding of where you stand as both a patient and a consumer, kind of see the odds you're up against. Then we're going to talk about what pain is, what pain isn't, and then we'll talk about what consists the components of pain. And then we're going to look at some more practical advice, looking at soft tissue injuries, some old advice, and then some new advice. And we'll have some time for Q&A at the end. All right, so let's jump in. So before we get started, just want to kind of remind everybody, I'm not a doctor. There's nothing in this presentation that's medical advice. I'm not trying to diagnose anything or provide treatment. If you have any questions about certain things I talk about, make sure you run that past your physician or your primary care. This is just more information to make you a informed consumer or patient, and it should be taken as medical advice or direction. So now that we've had the lawyers taken care of, we can hop into the content. So as I was talking about, let's take a look at the pain management industry today, just for some context to look at where we are with pain and pain management and talk about how this kind of business of pain management looks today. Real quick, big Beastie Boys fan. Um, as you can see, now you can shuffle numbers, but facts is facts. Just going to dive into some numbers here. There's no judgment, no nothing. It's just the reality of the market. So if you look at the pain management market across the world, you can see that in 2024, it's a $78 billion, and that's US dollar market, and it's anticipated to grow to 93 billion in 2029. So in about 5 years, it's a pretty good increase. You can see that the largest market is in North America, and you can see some of the major players there. So it's a pretty lucrative industry, and that's pain management, right? So that's different, either pharmaceutical or medical prevention or different, surgeries or things like that. Now, this is specifically therapeutics in the US. So if you look at 2022, it was a $25 billion industry, and it's projected in 2030 to be a $33.7 billion. So it's growing about 3% per year, just under 4. So it's a pretty big market. And just again, to the context, uh, you know, not trying to say anything, not trying to throw any shade on any professions. It's just there's a large amount of the industry and a lot of money flowing around in pain therapeutics and pain management and drugs to counteract and deal with pain. Plus, there's a lot of people with pain. So let's hop in now that we've kind of set the stage, what we're up against as a consumer and as a patient. We're going to talk about what pain is and what pain isn't. So the first thing, what pain isn't. So pain is not the same as tissue damage. So two things here. We're going to look at extreme cases of each one, but you'll kind of get an idea of where we're headed. So having pain doesn't mean there's damage. And the opposite of that is having tissue damage doesn't mean there's pain. So we want to try to disconnect the idea of pain and tissue damage. So we're going to give you some really broad or extreme examples here, but hopefully it'll paint the picture of what we're talking about. So here's an example, and it's an X-ray. This is real. So a construction worker complained of a toothache, had a pain in the roof of his mouth. He went to his dentist, and as you can see, the X-ray revealed a 4-inch nail in his skull after he had an accident at a construction site 6 days earlier. So I guess he tripped and the nail gun went off, chipped his tooth or something. And then a couple, days later, he's like, hey, this kind of hurts. Like, let me see what's going on. So he has clear damage, right? There's a nail up through the roof of his mouth. However, he didn't really have any pain until a few days later. So this is an example of tissue damage without pain, right? So that's the one example on one extreme end. Now here's the other extreme end. So as you can see, here's an X-ray, again, another construction worker you can see the nail through his foot, through his steel toe boot. So you can see the steel toe on the X-ray there. However, the nail had passed between his toes, didn't even graze his skin, and he's screaming in agony. So this is an example of pain without any physical or tissue damage. So you can see these two examples are super polar opposites. But the point is, pain and our perception is a lot to do with our brain and our emotions. So we're going to hop into that, but I just want to give those examples of tissue damage versus pain and how they're different. So now let's look at the components of pain. Nociception, which is a fancy word, but we'll talk about what that is, plus emotion equals pain. So what is this fancy word nociception? So what that means is it's a stimulation of pain receptors. In humans, there are three types of cells: thermal, mechanical, and chemical. So thermal, think hot or cold, right? So hot can cause pain or cold can cause pain. Mechanical is pressure or deformation. So what, if you push on something really hard, or if, somebody, hits into your like thigh or arm, so that's more of a mechanical type. Chemical is exactly what it sounds like an acid or some type of chemical substance, and you feel the pain from that. So those are the type of sensory nerves that get stimulated, and there's different ones. So thermal detect only hot and cold, mechanical only detect pressure or deformation, and chemical. So we have a bunch of these all around the body. So one component of pain is your nerves that detect certain stimulus. Then another component of pain that's super important to identify is emotion. So this could be any of these, right? Fear, anger, anxiety, frustration, but just recognize that part of pain is the mechanical or physical or biological stimulation of nerve cells. And also there's an emotional component of pain, which is fear, anxiety, frustration, whatever. So those two things are important to address when you're trying to get out of pain. Some research shows that these emotions on the screen here are key emotions that drive or worsen chronic pain. So you can see fear, anxiety, anger, guilt, grief, and helplessness. Those are, pretty self-explanatory emotions, but it's shown that any type of these or having these emotions or one or more can both drive, or if you already have pain, it can worsen it. So we want to make sure we address the emotional aspect of pain. This diagram here is a little busy, but we'll talk about what it is. So you can see at the top, you have an injury, and there's two, tale of two cities, right? So you come down and you have two options. If you come down, you have a painful experience with the injury. Let's go to the left. So if you catastrophize it, it's a big deal. Everything hurts. Woe is me. The big painful experience. Then you have fear of movement, or you're afraid of re-injuring it. Then you avoid the movement, and now you have disuse and depression, disability, and you're kind of on this pain cycle on the left-hand side. Or another option is you have an injury, you have pain, and then if you don't catastrophize it, then you can like, hey, let's figure out how to deal with this, and then you more easily lead to recovery. So this is the not visual version, and here we have a little bit more of a visual version. So you have an injury that leads to pain, and you have two options. So you have the avoiding pain, right? So fear of movement leads to avoidance, which tends to, prolong the pain. You avoid the movement, you don't heal as well, and then you have continuing problems. Or the other option here is from that fear, you recognize, hey, you know what? I need to move in order to heal. And then that leads eventually to a more successful recovery. So dealing with that fear of movement and fear of re-injury is super important when when you're thinking about pain and how to get out of pain. So another thing that's super important to realize is pain subjective. So your pain isn't the same as my pain, and my pain isn't the same as your pain. We've all had different experiences. We have different things we've lived through or gone through. So pain is very subjective. Think back to the examples. The guy had a nail through his roof of his mouth, no pain whatsoever for the most part. And then the other guy had a nail through his boot, but not his foot, and he's screaming his head off. So again, pain is very subjective. So the important notice here is, when you're talking to people about pain or talking to providers or doctors, whatever, just remember that not every pain is equal. So that some people might not be able to appreciate or identify with the pain that they have or that you have, because everyone experiences pain a little bit differently. So that's kind of the high level, kind of the background of looking at pain. So now I want to kind of pivot and talk about, a more tactical approach and some useful steps you can use. So we're specifically talking about soft tissue injury. So that's pretty common. You sprained ankle, twist your wrist or something, or common like reuse injuries due to repetitive motion. So let's take a look at some strategies for soft tissue conditions or pain. So first, we're going to look at some outdated advice. So as I say here, easy to remember, hard to forget. I'm sure most of you are familiar with the acronym RICE: rest, ice, compression, and elevation. So that was created in 1978, just to give you an idea how long that's been around, by Dr. Gabe Mirkin. So easy to remember, hard to forget. He came up with it in 1978. Doctors, trainers, everybody kind of latched onto that. In 2014, Dr. Mirkin, now think about this, this is the guy that came up with the protocol, said, hey, coaches have used this for decades, but it now appears that both ice and complete rest may actually delay healing instead of helping. So everybody got the message in 78 and ran with it because it's super easy. Has a, hey, rice, use rice. Hey, everybody use rice. But the guy that came up with it, or the doctor came up with it, went back and was like, hey, you know what? It was kind of wrong. So that's the thing about science, right? Things work until they don't, and then hopefully we all have open minds enough to change and take advantage of new discoveries. So instead of rice, let's take a look at a new way to do this. So rice is out. It's time for peace and love. So here's what the new science talks about and the way we're going to look at soft tissue injury. So peace and love, and we're going to break these down and each component and talk about which one and what they mean. So immediately after the injury, so we're talking about 1 to 3 days. So that's the peace. So P is protection. So avoid any injuries or movement that increase the pain. Hopefully that's obvious, right? If you hurt yourself, sprain your ankle, the fact that your ankle hurts is actually protective. We like to run and take anti-inflammatories or Tylenol or Motrin or something to dull the pain. But think about historically as humans, when something hurts, you don't want to use it, which is a protective mechanism. Elevation is the E in peace. So higher than your heart, right? So kind of put it above that, helps limit some of the pulsing or the throbbing or kind of limit the blood flow. A, this is a interesting one. Avoid anti-inflammatories. So part of what we do societally is we run for medicine to get rid of inflammation. Well, inflammation, sorry to say, is actually part of the healing process. So taking a medicine to prevent part of your healing is kind of counterintuitive. And science shows that taking some of these medicines actually delays healing. And then it also says in there, there's an A, like towards the end, it says avoid icing. So same kind of thing. Icing kind of knocks down the inflammation as well as the drugs do. Compression. This is actually the holdover from the rice, so the C made it through. So using elastic banding or taping to reduce swelling, which is perfect. You can use that. And then E, this is kind of a new thought here, education. So your body knows best. We have to learn to listen to our bodies and avoid unnecessarily passive treatments and medical investigations. So if you sprain your ankle, it hurts. It hurts to walk, but you don't necessarily have to go do some crazy foot exercise or something like that. Just think about, hey, this hurts. I'm going to kind of let it rest, elevate it, use a bandage or a tape around your ankle or something, and give it some time. So the thing I say down here in the corner, stop trying to chase a miracle cure, right? Let your body do its thing and your body should heal itself. That's not saying if you have a fracture or some type of larger injury, you shouldn't seek immediate medical attention. This is, again, soft tissue injuries. So after the first 3 days, right? So we got first 1 to 3 days, we got the peace. Then you got the love, right? So after 3 days, your tissue needs some love. So let's take a look at what that means. So the L is load. Let your pain guide your return, right? You're not going to, jump up from a sprained ankle and start, run a marathon or run a 5K or something. So add load and gradually return to your normal activity, but listen to your body, right? Deal with the pain, and it's not no pain, no gain. It's, hey, let's do what I can without pain. Optimism, right? Again, dealing with that emotional part of pain is that you want to have optimal recovery and with, hey, you know what? It hurts, it sucks, but I'm going to get through this, right? So being confident, being positive. This next one's a big word. We'll talk about what it is. Vascularization. So what this means is you want blood flow into the area and you want to kind of increase that. So pain-free cardiovascular activities. So if you had maybe a sprained ankle or something and you're able to walk, or maybe you can ride a bike or ride a stationary bike, something like that, you're getting your blood flow to let that good stuff come in and flush out the waste products and the bad stuff. That's not to go do some killer cardio workout. It's just saying to increase your blood flow to increase the recovery process. And then finally, exercise, they kind of tie together here. So restore your mobility, strength, and proprioception. Proprioception is your body's ability to feel where it is in space. So it's going to be a little wonky if you have some injuries. So you want to give your body a chance to, get that mobility and strength, and then also feel where your body is in space again, because sometimes you have some injuries and your nerves might be a little pissed off and they're trying to, hey, what's going on here? And I can't use my arm to do that, right? Your body will solve the problem. You have to give it a little chance through this process to recover. All right, so that was peace and love. So one other thing here to remember, right? So rice is out, peace and love is in. But let's take a look at one other thing that people get a little wrapped up about that I see as I work on people, as a manual therapist. A lot of people like to show like images or, hey, you want to see my MRI? You want to see my X-ray? And I'm kind of like, nah, let's just deal with who you are today. So if you think of imaging as a picture, so if I, run up to you and smack you on the arm and take a picture of you, you're going to have an angry face or something like that. Does that mean you're always an angry person? No, that just means that's a snapshot in time. So this bad imaging, right? It doesn't mean you're broken. You're not your diagnosis, right? And your body's healing. So have some patience, give yourself some grace. Um, you don't necessarily have, if you don't have to become your, oh, I have this bad image. Like, there's a lot of research. We'll maybe do a follow-up episode or a follow-up session. Um, Most people, I think there's, I don't know, some 50 to 60% of people that have no pain, that if you do imaging on them, they have some type of issue, whether it's a bulging disc or, you know, uh, you know, torn this or torn that or whatever. So people that are walking, living their life pain free, doing what they can, and there is zero pain, but they have bad imaging. So don't let your imaging become your identity, right? You're not broken, you're not your diagnosis, and your body's always healing, right? A friend of mine used to say, you're on your deathbed with cancer and you cut your arm. As you lay there, your body will still heal the cut, right? So even at your worst, your body's always healing. So just give yourself some patience, give yourself a little grace.